Some
Hello, and welcome again, once again, to the Social Justice Series. Today, we're going to be discussing trauma, stress, and mental health. And I am so excited because we made it through COVID. But even so, many of us are stressed out. We are going through some type of trauma. And so hopefully you all will get some pointers as we go through our panel discussion today. I am so honored to have Dr. Audrey Townsell. She is a licensed clinical psychologist with over 20 years of mental health executive leadership experience. She is the owner of Calyx Psychological Services, where she offers individual therapy and consulting services for governmental and private organizations in strategic planning and mental health program development. She also currently holds the position of Senior Vice President of Clinical Services for Alliance Healthcare. Thank you so much for joining us today, Dr. Townsell.
No, thank you for having me today.
Next, we have Brandy Flynn. She has been in the counseling field for over 2 decades and has a growing private practice, including conducting therapy, training for corporations, speaking engagement like this one, and media correspondence. Her service to the mental health community has awarded her a 2014 Best in Black Award for Best Counseling and Consulting Service, and she was a 2015 Women of Excellence honoree. Congratulations and welcome.
thank you. I'm so honored to be here with you guys today.
Thank you so much. And last but not least, my colleague, Commissioner Charlie Caswell Jr. He is a husband, father, community leader, author, entrepreneur, outreach pastor at Impact Church, and a Shelby County Commissioner. And he's always on the go. Welcome, Commissioner Caswell.
Thank you, Commissioner. I appreciate you having me on today.
Thank you so much. And so I have a series of questions. And the way I'm going to do this, I'm going to ask you individual question individually, and then I'm going to open up for a discussion part. And first, I'm going to start with Dr. Townsend. The first question for you, how does the intersection of race, gender, and socioeconomic status affect mental health outcomes?
Right. Well, there's been tons of research that shows that all of those different entities directly impacts mental health. I think, especially in our community, a lot of our community residents are living below the poverty line. And so poverty is actually directly correlated with trauma and mental health stability and success. If you don't have your basic needs met, and the basic needs, if anyone knows the Maslow's hierarchy of needs, I'm sorry, that the base is making sure you have stable resources like home, shelter, so that you can fulfill those higher entities on the hierarchy. So if someone is struggling with basic needs like lights being cut off, food being given three meals a day, and you think about even the children, how are then they're going to kind of function at school, how they're going to concentrate. And so even just those particular socioeconomic elements can impact and even cause trauma for some people.
Yes, I can imagine it would be stressful for our children. I'm just, wondering where I want to, sleep, or where, what I want to eat, and those kinds of things. Yes, very good. Next, Brandy Flynn, as the founder of Breaking the Barriers of Mental Health, what are some of the unique cultural factors that influence mental health outcomes in the Black community?
Some of the unique things that I have seen myself just working again, like I said, just a lot of people were living up under the poverty line and not being able to get their basic needs met. And of course, it's sad to say, but there are some resources that are easier to gain for some people than to others. And then just some of the things, the generational things that we have been dealing with, with generational trauma, with slavery, with Jim Crow, the disparity of pay. So a lot of those things have pulled us back than, I would say, than our white counterparts. So those are just some of the things that I've seen where some people may feel like it's an easy fix, or they may not have to deal with it, where there's a whole community that is dealing with those things. And it's just trying to meet the people where they at so we can help them to get their basic needs met, and hopefully to get them to the next step to get their mental health needs met.
Okay, thank you. Commissioner Caswell, as a community leader and pastor, what are some effective community-based mental health initiatives tailored to the needs of minority populations?
Again, thank you, Commissioner Sugar, for this opportunity. I just say for years, the work I've been doing around addressing adverse childhood experience and really getting to the root cause of those traumatic issues. A lot of these things that these doctors and therapists have shared today, I pray that we as elected officials and people even higher up, even at other levels, listen to this, because again, this has been repeated over and over again, but yet our policies many times don't line up with that. But I was blessed over the years to work with somebody in our community who do great work around trauma and mental health, Dr. Stewart, Alpha Stewart, with the University of work, and she still continued over there at the University of Tennessee, that focus on basically connecting our young people and children to therapists and counselors, something that has not been normal in our community. I remember when I started talking in 2016 around ACEs and trauma and going into churches and talk about it, people was like, that was like taboo because it was usually just pray it out. But this is not going to get prayed out because, again, as these doctors and therapists have shared, we're talking about generation. You can't break the curse until you really heal. And I often say this, Commissioner, that we try to build when we fail to heal first. And then we wonder why these cycles continue to go over and over again in our community. So it's a lot of work being done, I say, at the grassroots level. When you talk about the council, the county commission right now, our investment into the Youth and Family Community Resource Center and that mental health work that is being done. I tout that. I put it on my page. I share it in all my newsletters that these families can get connected from 13 to 18 years old, free mental health counseling and services. Tap into that. Again, it's not what's wrong with your child if you reach out for help. We are addressing what happened to your child. And they just shared a lot of these things that are happening. And we are in the city, sadly, with the number one per capita murder rate, sadly, right now in this country. And so every day you're waking up to news of somebody killed and these kids walking out of homes seeing this murder. So we cannot just continue to sweep this down the road because it's not going to help be good for us as a community.
Okay, you also mentioned ACEs. Can you talk a little bit about the ACEs training and when the next training? Because I have not gone through it. I know my brother has, but I would love the opportunity to do that as well. So what is the ACEs training all about?
So for many who don't know about ACEs, Adverse Childhood Experiences, it is a research study that was done by the Center for Disease Control back in 1995-96, and done this at a high level with Kaiser Permanente, and basically they looked at around 17,300 individuals, and now this study has been done all over the world, where they connected again the childhood trauma of what happens to a child before their 18th birthday. That's physical abuse, emotional abuse, that's physical neglect, emotional neglect, that's household dysfunction, such as mental illness in the household, divorce in the household, drug use in the household, and separation of parents. And so when you take that in the mind of a child, I was talking to a parent earlier today, when you take that into a mind of a child who begin to mirror that behavior and that trauma, we think that's normal. And I know your brother and others have done around the justice system saying about blended sentence, how the brain don't fully develop till it's 25 years old. These kids had endured all of this as normal all their life. And then now it's time for them to go out here into the real world. And then we think that they should know what's right and wrong, but all they seen was this trauma that have impacted them. And I'll wrap it up quickly to just say that what a lot of that research showed, that children who experienced 4 or more of those traumatic experiences before their 18th birthday was like 50-60% more likely to use drugs and alcohol, the behavior that end them up in juvenile system mainly. And so we're locking people up for what happened to them instead of addressing what is happening to them. And when we leave them in many of these environments that we know this trauma is happening. So yes, I've done this training for almost 10,000 people around the country and been blessed to do this work and training. I know I'm doing some for schools for professional development days that's coming up, and Commissioner. And I'll let you know, I don't have one just on the book outside of the teachers and schools that I'm doing in the next couple of weeks. But I'll make sure that I get that to you so we can share it out, because I've been working, training other folks to train so that they can go out again to change the philosophy of what we've been doing as a society so that we can put proper practices and policies in place that change the trajectory of what's happening to our children when they end up, sadly, before your brother in that juvenile court system.
Thank you so much for that. And that was very powerful what you said. We're locking up people for things that happened to them without addressing things they've gone through. That's powerful. That's very powerful. Thank you. Dr. Townsend, how does childhood trauma affect mental health in adulthood? And number 2, how does chronic stress impact physical health over time?
Right. So I want to kind of piggyback on what Commissioner Caswell spoke about when the child experiences trauma, what it does to the brain. So if a child as you said, the brain doesn't stop developing until mid-20s. So if a child experiences trauma at an early age, the brain actually kind of rewires itself to adapt to that trauma. So it's not as if, people who haven't experienced that trauma, they would see it as abnormal. But a child growing up in those particular environments, their brain is really processing that trauma to be adaptive so that they can survive growing up. I call them in my practice when I'm working with people with trauma, we call them heart wounds. So when we talk about traumas in their life, and trauma can be on a continuum, just like any mental condition. It can be on the very extreme end, or it can be on the very kind of low severity end. And so, but it really depends on the person's adaptability and their resiliency towards whatever trauma they experience. Something that may be traumatic to me may not be traumatic to someone else. So if we have a child experiencing even a low level trauma over an extended period of time, their brain chemistry changes. And so it's almost like a coffee filter. If you put a trauma coffee filter in a child's brain, they're going to filter all of their experiences, their perceptions, the way they see themselves, the way they see the world through that trauma filter. And so as if it goes untreated, there's no interventions, that means that that child is going to grow up to be an adult with that same type of trauma filter. And so then we look at what are the behavioral ramifications of untreated trauma. One, we can look at the emotional implications. When I look for trauma, trauma is one of those specific entities that it kind of masks itself under other mental health conditions, right? And so it can look like depression. It can look like anxiety. It can look like lack of concentration, inability to sleep. It can also look like extreme irritability. And I think for a lot of us in our community, we're seeing a lot of anger, a lot of aggression, right? And what if that's that person's their ability to have adapted to that trauma that they've experienced at a very young age? So those are the things that we look for, and that's kind of how that intersects. When you talk about a child experiencing trauma, you'll eventually, if untreated, have an adult who exhibits some of those antisocial type of behaviors that we see that kind of end up in the justice system.
Let me ask you a quick question. And so, as an educator, you mentioned some of the things, that traits or things that young people can exhibit, like irritability, sleepiness, being withdrawn, and things of that nature. And so, the question then becomes, if a teacher observes a child, for example, who's constantly, withdrawn or constantly sleeping, what steps should we take as an educator to support and help this child get the help they need?
Right. So I do know that a lot of schools have school counselors. I know that Alliance has a school-based behavioral health liaison program that's embedded into some of our identified schools, where they can help support those types of children. Definitely, the faster you intervene in a trauma situation or a traumatic situation, the better the outcome. So if especially if a teacher starts to exhibit some severe changes in a child's behavior, you definitely want to be able to contact a counselor, contact a parent, because sometimes parents will give you information that will be helpful for you as an educator to be able to kind of assist that child while they're in your care. So for educators, I would definitely encourage them, make sure you talk to the child. Sometimes it could be, well, I just stayed up late last night. It was not a big deal. Or, I had to stay up and watch my brothers because my mom had to work 2-3 jobs, and I didn't have anything to eat, because it had research is showing that trauma definitely impacts school performance.
Right.
So definitely want to make sure that the educators are aware of that, and then they have resources to be able to connect those children to.
Okay, thank you so much. This next question is for Brandy Flynn. What are the barriers that minorities often face in accessing mental health care, and how can these barriers be addressed?
Some of the things that I have heard that minorities have encountered is the lack of, I don't want to say lack of mental health, but lack of resources, lack of the knowledge of it. A lot of times people just know the big names, like in the city of Memphis. They just know of Lakeside or Parkwood. They don't know the smaller places, and also just the lack of knowledge of getting insurance, or feeling that, I only can utilize these resources if I have insurance. You'll be surprised of how many people have the money to pay for it, like even an individual session, but they feel like that they can't get these services, as if I can't go unless I have insurance. And then, like I said, just the resources, the availability of the resources. It's to this day, I could be driving around and I could see, like, hey, that's a mental health facility, or that's a mental health place. Like, I've never heard of these places. So I would say a lot of these places need to be out more in the community and let themselves be known, and not wait until a crisis happens. I always tell people that's when we really talk about mental health and resources, is when a crisis happens, even a severe crisis. But if we make it known in our everyday conversation, then it would be more feasible for us to get to these, and more attainable for people to want to go and get these resources.
Okay. And so a lot of times you hear that, to your point, when I understand that not everyone has insurance, and you're going from place to place. We're very transient. And so, having said that, are there any services or programs out there that individuals can access if they don't have, for example, the resources, or they don't have the insurance or enough insurance to cover it? Are there any programs or services out there? And if so, how do that people connect to those services?
There are plenty of resources. Dr. Townsend can probably name them more than I do, since she's worked in, within the community-based services. But there are plenty of places that, do low income, do pay as you go, or even do free sessions. Or there are some places that don't accept insurance, but they do private pay. Because, like I said, it's to a point where we have to understand, at the end of the day, people pay for what they want. If people can put aside money for the latest shoes or latest purses, they can also put aside for the therapy session. And it's really just asking, if you have insurance, to ask your insurance agent, which providers take the insurance. And then also, like I said, there's different places in the city that offer little to no places, or there's other organizations like NAMI. But like I said, we need these organizations to be out more in the community, so people will know that they exist, and also know where to go if they need these services.
Okay.
And I can chime in on that as well. In the words of our CEO at Alliance, Lori Powell, she always says, through any door, which means that anyone who is experiencing any mental health condition or any mental health crisis, they can come through any door of Alliance and they will receive service despite their inability to pay. So Alliance is definitely an agency in the community, a resource in the community that provides services to people who don't have insurance, who don't have the ability to pay. So, and there are definitely more agencies that are available. But, in addition to what Brandy said, one of the things that I would like to see more in Shelby County is a mental health consortium, where we have the ability to meet as, multi-agencies to kind of come together so we can provide better services to the constituents in the community. A lot of times people don't know where to go. They don't know who's providing free services. So to be able to kind of come together and create some type of system where they can tap into those services based on their inability to pay. But Alliance Healthcare Services is definitely one of those agencies that provide service despite ability to pay.
Is that something that on the horizon of Alliance, as far as the mental health consortium? I'm just interested.
Well, we're working with the Shelby County Community Services under Sandy Broomley, and we've been doing a mapping program for quite some time, and it's really about identifying those high utilizers of mental health services that also are kind of cycling in and out of the jails. And so we're trying to identify a process starting with MPD because they're the first, or the sheriff's office because they're the first line of response for a lot of those patients. And so we're working together as a multi-agency system to kind of identify what are some of those concerns and needs that can be addressed so that we can be able to provide better services. And that's one of them. So that was one of the recommendations that we're working through in that mapping consortium.
Commissioner Caswell?
Yeah, Commissioner, and I want to just chime in on that particular note because we had the blessing opportunity to pass a resolution and resources for just this this conversation when we talk about people not being able to connect to those mental health services. So at the Youth Connect, it's Youth Connect at the braidfoundation.org. Again, that's Youth Connect at the Braid, BRAID foundation.org. And that collaboration partnership came from stakeholders before I was elected. I was blessed to be in some of those conversations when we was talking about children mental health. We was in the pandemic at that time, and we like, how do we get these children connected to mental health services? And so when the launch of this through the leadership of this commission to put the dollars there now allows them to go online and be able to to not only choose their own therapist, they're able to choose whether they want to have a telehealth. They can choose if they want to do group session or one-on-one session. Again, this is free. And this is something that our county saw the responsibility to do. And for me, just saying, coming out of that pandemic, we now have to truly look at mental health as a pandemic issue, right? Or if we have an epidemic of people who were stuck in was in quarantine with people with domestic abuse, violence, and crime for 2 years, and we came out continually doing business as usual. So it's so much that I seen. I was listening back to our public safety meeting back right after Eliza Miss Fletcher situation and Ezekiel Kelly when we started the public safety ad hoc. Everybody pretty much on that ad hoc committee came out saying mental health, mental health, mental health. And this commission, we've been listening. You have helped lead the charge on taking us to Nashville, seeing that need to do it for our inmates in jail, but also this right here, a Youth Connect work that is available for free to our community. And I'll make sure I put it in the chat so that they can share this out with our people in social media.
Thank you so much. Next question. What strategies can be used to reduce the stigma around mental health within minority communities? You hear, for example, this using gender, women will tend to reach out before, some of our men. So how do we reduce that stigma of reaching out and getting these services? And anybody can answer that one.
I think what we're doing now is definitely helping. When people talk about, mental health is taboo in our communities, I definitely will say that I have experienced that in the past, but I am happy to say that, taboo, it's not taboo as it was before. Mental health has become a really a talking point in a lot of our communities because of, forums like this, because of there are people in high places who are not afraid to talk about mental health. We have pastors in churches who are now encouraging people to go to mental health care. And really, we're seeing a lot of celebrities, particularly athletes, who make it okay to reach out for help. And that kind of, I think that has moved the needle in some extent, but also having services that are culturally competent and having therapists who are culturally competent. So when they receive these calls, when they receive these clients, that they know exactly what they're looking at, and they know exactly what will be helpful based on that particular person's cultural development. So I think that's really, really important for us to have trauma-informed therapists, but also culturally informed therapists, but also continue to push the word out and to make sure that everyone knows that if you don't have a stable mental health, everything else doesn't work for you. You won't, you'll have difficulty in relationships. You'll have difficulty in schools. You'll have difficulty keeping jobs, even your physical health. If your mental health isn't stable, how can you take care of your physical health? So just making sure that everyone is aware of the importance of mental health services through forums like this, I think is really important and has been impactful.
And to your point, Dr. Townsend, how does your mental health impact your physical health? Can you
Well,
elaborate on that?
yeah, absolutely. Particularly if you're talking about trauma, that when you experience trauma, your body goes into a fight or flight syndrome, right? And so, if that is over a prolonged period of time, you'll have increased heart rate. You'll have tension in your body. A lot of people who suffer from traumatic experiences have a lot of somatic complaints like headaches, inability to sleep, things of that nature. So there's a definite correlation between your mental health and your physical health. But even if you don't have a traumatic experience, but you have maybe other medical conditions, if you are not stable mentally, how can you then care for yourself physically? And so it's almost like a continuum. I call it a triangle: mind, body, spirit. They have to be balanced. So as much as possible, there's no such thing as perfect balance, but at least the understanding of how your mental health impacts your overall quality of life.
Okay, very good. Anybody else want to jump in?
I
Commissioner
do.
Caswell? Okay.
I
Go ahead.
do. I want
No,
to
go ahead, Sister Brady.
piggyback with just to add on what Dr. Townsend said. Even with the forums like this, but even to have informal conversations, like when you're having conversations with your girls or with your guys, and being able to not be ashamed to say, hey, have you thought about therapy, or to share that you've been going to therapy. I've noticed that a lot of our are they Gen Zs now, whatever comes to the millennials, they are really for therapy. They will go to therapy, and a lot of our young entertainers, they're making songs about therapy. They're making therapy cool. So, and they make it everyday conversation. They have conversations like, you're not going to therapy, like, what's wrong with you? Whereas our age and above, we feel like all we have to do is just pray about it. And yes, you still pray about it, but once you say amen, let's come up with a plan on how we can deal with our mental health. And I also want to add, because I know some people may feel like what Dr. Townsend said, like, well, I don't have heart conditions, this and that. Well, you know what? If your mental health is not together, your weight is not going to be together. That you constantly losing weight or you're constantly gaining weight because you're holding in that stress. I tell people, you go to the gym 5 times a day for 2 hours, but if you're not working up here, you're not going to lose none of this. So maybe that point would get some people to really think about their mental health.
And also, if individually you admit to it, as a classroom teacher, teaching COVID, that was extremely stressful for me. I said I have to take a mental break because I hated it. It's so stressful. I mean, talking all day to yourself, basically. And so I just finally had to take a leave of absence. And so, explaining that to the students, we need to talk, we need to socialize, we need, trying to get them involved. But it just broke me down, as far as the COVID teaching. A lot of teachers, maybe not even realize they're going through a trauma and stress. But you've got to take care. Self-care is so important, but also admitting it and to expressing to others, it's okay. Yes. It is okay.
Right.
Commissioner Caswell.
Yeah. No, I think the doctors, they hit it, the therapists hit it on point that, it's not what's wrong. It's about what happened.
Right.
And so if we can get to the place of addressing what happened to us, right, and going to get help. If you got shot or stabbed, you're going to go see a doctor, right? When you get impacted by trauma, you need to go see a doctor. You need to see somebody who's able to help you heal from that particular answer, or that cut person begin to cut other people. Hurt people. And when you fail to get hurt, that healed from what you've been hurt from, you become that hurter. And when we look at that, I appreciate Sister Brandon just sharing about even the obesity impact of it, the higher level of trauma, the people who got the highest level of traumatic experience as young people are at risk of obesity, COPD, really a lot of stress issues, as she shared, Dr. Dr. Townsend said, education. We trying to figure out the literacy part. How can you read, as a young man myself who witnessed my friend killed at 14 years old, another friend shot in the head at 15 years old, those teachers asking me where your number 2 pencil, I didn't see nothing on the paper but a dead body. You need to ask what happened to that child, right? That individual who's now not able to focus because he's chimed in on that trauma. And so we got to stop acting like, because we come out of normal places in relation, that everybody comes out of that place. And as Dr. Townsend said, trauma hits each of us different. I may experience 8 and be okay. Why? Because I had mentors and resilience and those different people who were in my life to help me overcome. But that person who experienced that one parent who was divorced, still dealing with that emotional neglect, may not have anybody to chime in. Now that person ready to kill themselves just from their one traumatic experience. Why? Because they're hurting and no one has helped them heal. So I think that is very important that we have these conversations. I'm thankful that at the church level, many pastors who I have allowed me to come in and minister this. Many of the pastors I work with now use this ACEs training assessment before they even married people, right? We were able to get some legislation passed, House Bill 2588. So now if you get divorced in the state of Tennessee, you got to go through ACEs training before the judge sign off on your divorce. We're trying to get it before you even get married. Why? Because if you marry somebody that has not healed, they're going to bring out that trauma in their relationship. How can I know? Because I'm married the second time. Thank God I'm healed now. But the first one was hell on wheels. Why? Because I brought all that murder, all that drama, all that trauma into that marriage. And I can say it was me who was standing in the need of not only prayer, but standing in the need of a therapist that helped me really understand. And Dr. Stewart did that for me. So I was able to now do this for our.
And I'd like to also add what has been helpful in increasing the numbers of people, of particularly Black people being more engaged in the discussion of mental health talk, is that we're seeing more Black therapists. And so I think that has been a huge impact, because it really impacts someone to be able to go to, be vulnerable and open up your, the things that you won't disclose or discuss with anyone else, to have someone that looks like or reflects you. So I think that's really important. Statistics show that less than 2% of psychologists are Black. So we still have a long way to go, but I think it's really important that we encourage, people to, particularly people of color, to kind of go into those fields so that we have more representation in the mental health field.
Yeah, that is very important, because as a foster mother in youth village with particularly girls who have been experienced all kinds of trauma, but the trauma against them by males, and then they have to go before a white male, and I was like, where are the women? Where are the Black women? Where? And so that is a very good point. Is we need more Black psychologists, psychiatrists, and people of color in general in that field. So how do we support the efforts to get more people to go in the field of psychology and psychiatry? How do we do that?
I could tell you from a political standpoint, how you can support is, we have to make it more attractive, a more attractive field. I do know. My particular professor, when I was in graduate school, told me, if you're in this field to be rich, then you might as well drop out now. But it really kind of is disheartening that we go to school. A lot of therapists go to school, and we accumulate this debt, but then we come out and the jobs are not reflective, or the pay isn't reflective of the importance that society says that the role is. So I think that if anything, that we can lobby, politicians, we can lobby our state with federal government to look at incentives to encourage people to go into the field, so that they're not struggling between, do I now have trauma so that I can't pay my bills, or versus helping someone who also has trauma too. So I definitely think that's something that we can look at as a society, because we're talking more about mental health, but let's reflect that in how, in the pay equity of some of our therapists and doctors.
Okay, I'm going to quickly go to the questions on the in the chat. First, is mental illness genetic, and how does it impact? Where do you go? I just went down. And how does it impact their childhood and their Okay, the screen keeps moving. Okay, how does it impact the child if the parent has a diagnosis?
Do you want to take that, Brandy? You want me to answer?
I can. So mental illness is just like a physical illness. Just like with cholesterol, obesity, how different cancers, different things like that, those can be hereditary. Mental illness can be hereditary also. But how it impacts the child if the parent is diagnosed, if the parent recognizes that they have a diagnosis and they're already getting treatment, and then that will help them to better prepare their child. Now, just because the parent has the illness, that does not mean that the child will get it. They are prone to it. But if the parent is already doing the work, then it will, I don't want to say decrease their child getting it, but it will help the child to better handle whatever whatever mental illness they may have. Because that's the thing that goes back to the taboo, you know, where you're having a history of mental illness, of bipolar and schizophrenia. Well, you know, people don't want to call it name. They want to call it some other names. I don't want to say the names because they're not politically correct. But if we start having conversations about illnesses in our family, that can better help our children. And that's just also with your physical illness. I know I went through something, and when I found out, and people told me, "Oh yeah, with this and then," I'm like, "Well, nobody was gonna tell me." So, because when I would have found out, I wouldn't be so shocked instead of just wondering it just came out of nowhere. So that goes again of eliminating it being a taboo and being a stigma. But it can be hereditary. But if we go ahead and be proactive with it, the parents can live a successful life. The children can live a successful life. The children's children can live a successful life. So that's part of breaking the generational curse, is keeping it inside.
Wow. Anybody else like to jump in?
I'm gonna let the therapist handle that one. I just say that
go ahead.
Part of that research and study that the Center for Disease Control did about epigenetics, right, and talk about the DNA of the parents, the framework of the parents, and how that passes down generationally. And I asked this question at juvenile court one time. I did this training for 50 young men at juvenile court. And while I was down there, I asked them, I said, how many of you all have a relationship or know your father? Out of 50, 2 of them raised their hand. Out of 50, 2 of them raised their hand. And I asked, how many of y'all was told you act just like your father? All of them threw their hand up, right? Was told they act just like somebody they never been around, never seen, never known. Because why? They have the DNA of that. But just like the therapist said, though, as a society, as a community, we can help build that framework around them that cushion some of that trauma that they're carrying over from those generations. But that's why we got to be intentional about creating safe, healthy, nurturing environments, right? Being intentional about connecting them to those supports that build resilience and things that their parents may not never had. You talk about historical trauma and generational trauma. This is passed down. We not acting like we're acting just because something happened while the people are acting the way that they are.
Dr. Townsend?
Yeah, I was just going to just add more to that. Particularly when you talk about genetics, there's definitely research that shows that there is a genetic component when it comes to mental illness being passed down from a parent to a child. But as Brandy stated, that if a parent is engaged in therapy, the impact is less on the child. And also the child is aware that there are resources available to help if they experience those mental health symptoms. So definitely want to kind of add to what Brandy said, but also thinking about generational curses and just normalizing some of the things that we see in our families. You know, when I think about generational mental health, I always think about the Black grandma who's all just mean for no reason, right? And so when I have a client talking about, the relationships in their family and they describe this type of person, I always ask, do you know their story? Have you heard their story? Because grandma was just not mean for just to be mean. What if grandma was suffering from depression? What if grandma was suffering from some type of trauma that we didn't know of, only she knew about? And that's the way she expressed, or that's the way she expressed her emotions, because now she has emotional dysregulation because of her mental illness or because of her trauma, that's anger is the only way that she can represent it. So just being able to kind of identify those patterns in our families, so that we can break those patterns, and through therapy, can be very helpful to identify some of those trends and patterns in genetics and also generational kind of interactions with each other.
Right. And I like what Flynn also stated about, taboos, because a lot of times you hear about family secrets and things of that nature, but if you open up and talk about these things, you may find out, oh, there is a pattern, oh, there is some mental illness or something going on in our family genetically, and to both, Caswell and Dr. Townsend, you already talked about, going out and getting that support and that help. And if you're the parents doing it, then it, kind of makes it easier for the child to continue with those services. I want to go to Garrett. He really makes a great point. He said, just as we have annual dental and vision care, how can we have annual mental health checkups incorporated? And what I'm thinking about as a teacher, again, I'm thinking through the lens of a teacher, educator. Like, for example, we have a regular checkup for our kids to make sure that, there's a vision issue, that we can provide them a free, glasses and, dental care, things of that nature. What about mental health checkups incorporated?
Mm-hmm. Mm-hmm. Well, a lot of primary care physicians and primary care offices are having incentives through their healthcare payers or their insurance providers to incorporate mental health screenings in their assessments and their checkups. So we're seeing a lot of healthcare providers see the importance and are incentivized to incorporate those screenings in their practice. So that's definitely one way that we can kind of increase the screenings for mental health. But again, I like to tell people, I stay in my lane. I try not to, give people neurological advice because I'm not a neurologist, right? So that means that when you screen, you have to have the resources to be able to provide for that person versus a PCP, saying this is what's wrong with you, this is how you treat it, but they don't have the skill set to be able. And I'm not saying all PCPs don't have that, but just being able to identify, those whatever's coming from those screenings and being able to link them to appropriate resources, I think is really, really important.
And I also want to add to that with the PCP component, just like because therapists and psychologists and psychiatrists, we're all specialties. So a lot of times when you go to get a specialty for a medical, you have to go see your PCP. So a lot of people can get a referral for a therapist through their PCP, because what I've learned going to different doctors is that they're a community. Like, they know somebody, like, well, hey, you can go to this specialist. I know this person personally, or I know this person is in through my network. So sometimes your primary care physician can give you the referral, or they can recognize that, hey, something may be wrong with you, because you may feel that, there's nothing wrong. But if you have a PCP that, I like to say, get in your business, like know you by your name and know, your dog's name, and they're asking you questions, and if they're really paying attention there, and if you say something that kind of catches their attention, and they ask more in-depth questions, and they'll be like, well, hey, have you thought about going to see a therapist, or here's somebody that we have in our network that you can go see.
Okay, Commissioner Caswell.
Yeah, and I just say to some of the push and around legislation change. Even I know when former Senator Katrina Thompson pushed Senate Bill 0170 around all schools becoming trauma-informed, trauma response. One of my ask and push at the state level was that every child should have an ACE assessment. For me, coming into the school, we should know what happened, right? We should have a scan lens. I thank God for the work that Dr. Nadine Burks out in California, who became the Surgeon General of California, began to do in her practice, but then she became the first Black Surgeon General and the first Surgeon General actually in California, began to push this as a universal thing across the state, where you saw it in schools, and we created reset school, rooms here in Shelby County. But we need this at every level. I mean, whether you walk into a doctor office, whether you walk into a school, because no one is asking the question. I say we got an epidemic around just as if we had high doses of lead in the water, right? Lead in the water causes disruption of the brain, behavior issues, all of these things. ACEs and trauma cause the same type of impact, but no one is asking the question. So people are walking around with high doses of trauma that's about to explode, that's about to die early, and all of these, and we just going about business as usual. So we need to, and they happening to the least vulnerable, those children who parents many times are dealing with mental health, dealing with trauma, being domestic abused, don't want nobody, just as you said, talk about it. Now that child got to carry all that weight, walk into a school and expect to perform at a high level. We need to be asking that question. Registration day should have that. And then we need to be able to scale up that, because I really believe, Commissioner Sugarman, that if we are doing it at that level, downstream, upstream at that level, we wouldn't be paying for more jails to have mental health. We wouldn't be dealing with it at these later levels. To now, we didn't cost society much more money, and sadly, maybe somebody's life, because we just failed to ask that child what happened to them.
So let me ask you, Commissioner Caswell, that sounds like something we might want to add to our state legislative agenda, and maybe work with our schools, Okay. I like that idea of screening at the school level, because it would also help, teachers understand, situations better, because if you understand, where a child is coming from, then for example, a child's scared of boys or whatever, because they've been traumatized, we can support and help them better. So that's a great idea.
But you said a key, Commissioner Sugarman. That's a great idea. However,
okay,
when you have a screening tool, screening tool is only effective if there are interventions that are applied to that screening tool.
Okay.
So you want to make sure that if we're gathering this information, we're asking these questions, we have a plan of action when we get the results for those, because I see a lot of time that we can do more damage by asking the questions, and then we don't have the referrals, we don't have the resources, we don't have the proper handoff to care for, the symptoms that we've identified. So, I totally agree that we need more screening. We need to include the ACEs, but then what? So we want to complete that loop. Then what do we do when we get the answer that's shocking from the ACEs and they're scoring high on all these scales? Then what?
Yeah. And just to that point, one of the then what, and I seen somebody post earlier with Shelby County schools, where we seen at Cordova High School, then what's that other school in the South? Manassas, a couple other schools where they put these mental health clinics in that school, in that. Right? We need that in every school. We need those capacity of resources that parents can go and these children can go and get that mental health and those counseling services at that level, right? We don't need it just in 1 or 2 places. We need it in every school, and make those investments. And so I think that we're seeing a lot of more dollars, just like with Alliance now getting ready to build the child crisis center, just like the adult crisis center. Then how do we make sure that that is scaled up, right? Because this is what everybody is sadly continue to come back to, that something has got in the water of the people, and we got to address this, or else we're going to continue to see pain. We're going to pay for it, whether we pay for it now or later. We're paying for it.
Right. And so, Commissioner Caswell, to your point about having not only the students to be serviced, are these schools, Manassas, Cordova, are they also bringing the families? So families are being serviced as well?
Yeah, yeah.
Okay.
At those particular schools that they do have that, I know they're getting ready to do it at Raleigh, Egypt, Miller. I'm looking forward to that in my district, especially in that at that particular school where they have seen a lot of gang violence, gun violence, and things happening. To have that services there for all of those families and children. Again, parents can tap into that resource as well. So yeah.
Okay, so as an educator, again, I'm thinking through the lens of educator. For example, my school where I teach at, we had over the years a lot of suicides. And so, how, as an educator or a principal, how can we bring those services to the school, to that a particular school or school to the school-wide district? How do we do that? Is that something we have to do at the state level, or is that something we can do locally?
No, I think we can do it locally. I know Shelby County, Shelby and Memphis and Shelby County School, they have a mental health center that's available to all of the schools. So I think just, tapping into the resources that are already there. Also you're reaching out to your local community agencies. I know that a lot of agencies that have the resources are more than willing, if allowed, to come in and, provide support, even if it's through a training or how to detect depression and suicidal thoughts in children. So, I think just by reaching out and letting someone know what the school needs, I think is very helpful. There are a lot of, nonprofit organizations who support those causes. I know Brandy mentioned NAMI earlier, definitely reaching out to a lot of these organizations to kind of stay with your need. And I know I get a lot of calls from Alliance, but from everywhere else. If I don't know how to get it done, I will direct you to someone who can. And sometimes it's just a matter of asking what resources are available. And I think for the mental, and Brandy can kind of chime in, as a mental health community here in Shelby County, we're a pretty close-knit community. So if I don't know, I'm definitely going to kind of shoot someone to one of my colleagues who can be able to better assist.
Okay, thank you. And you all mentioned quite a few interventions, but again, what interventions have shown promise in improving mental health outcomes for minority populations in Shelby County?
You want to take that or me, Brandy?
You can take that one.
Okay. Well, but not just Shelby County, because I'll tell you a very sad statistic that Tennessee ranks one of the lowest states in how we care for our mental health our mental health concerns. So the goal is to do better, but just generally, research shows that psychopharmacology, which is medication and therapy, is the best
It
combination
is.
to treat mental illness or any type of mental concern. So coupled with therapy, some people just want to take medication, that's fine. But once you get to a place where you are clear, you have to have some type of therapy to be able to learn the resources and build resilience so that you can kind of reduce the possibility of relapse.
And I also want to piggyback on that with the medication and therapy, but also making changes in your life. You have some people that go to therapy, but they're not doing the work. They're taking the medication, going to therapy, but not doing the work. And people have to understand that taking the medication doesn't get rid of the problem. Again, going back to physical health, you can't, it's like taking a cholesterol medication, but you still going to the cookout and eating the fried fish and the barbecue ribs and the, you know, high salty food. You have to change your eating habits. You have to go exercise. You have to improve your sleeping habits. You have to work on your stress levels. So it has to do with all of that.
Yeah.
And supporting more peer support organizations. I know that Alliance has a huge peer support community. And what that is these are people who have, had struggles with mental health or substance abuse, but they have, been successful in maintaining sobriety or managing their mental health, where now they are actually supporting people who may be in a position they were years ago. And sometimes they can reach a client or a patient much better than a therapist can, because there are some people who say, you can't really tell me anything if you haven't experienced what I have. But what about a peer support who has experienced that? And so I think encouraging people who and getting them trained to be peer supports is definitely something that I've seen to be helpful as well.
Yeah. And I was going to just add to that, Commissioner Sugarman, because some of that peer support work came out of work that we did with Dr. Stewart initially. So when Dr. Stewart research showed that children that had 10 or more days of absence from school, chronic truancy, had higher ACEs score. So we actually worked with some of those families. Some of those families became a peer support specialist that's now working over Edelines through that work. So I've seen that work, but also the intentionality of that natural community support of bringing around that village, around that child and family. Have we seen the impact of that? Because many times, and again, not throwing no type of shade at these wonderful doctors and therapists, but you can give a person a pill and send them home to chill, but then if they have not healed because the environment in which they're returning to the same thing. So some of those children who we seen that wasn't talk to the therapist, where some of the better outcomes was that hug, that love, and that other that village that helped that child and individuals through that work. It's an African proverb that said that unless the children are embraced by the village, they'll burn it down to feel the warmth. I think that a lot of it, because of the trauma that they're going through, they're trying to get the attention. Just hug me, just love me, because that neglect and that trauma that I went through, y'all don't understand. And so I see that as the intentionality of natural community supports, being around these families and children can be that helps them break some of those cycles.
Okay. And also, I just want to mention that I see Judge Sheila Renfro is in the chat. And so if you have any comments or any questions, Judge, you're doing a great job. She's been really pushing for with the mental health court, bringing the individuals out of too unpopular and putting them in long-term care, and she's been, pushing that effort. She also went with Commissioner Caswell and some other commissioners to Davidson County to look at their mental health and behavior facility. So, Judge Renfro, if you have any comment or questions for the panel, but I just want to thank you for your work. And as we wrap up, I just want to thank my panelists for a intense and very informative discussion. And you have each a minute to say a closing comment or words of encouragement or whatever. Thank you so much. And we'll start with Commissioner Caswell.
I was going to say Dr. Townsend, but I just say to you, I think this was a powerful and much needed conversation in light of all that's happening in our community. I pray that someone listen. I just leave them with something that was given to me and through the Spirit when I first understand what a adverse childhood experience was and the impact that it was having on my life. That is, slow your ACEs down. Right? Slow your adverse childhood experience down, get connected to the services and support, heal so that you can build and be the best thing that God has for you.
Thank you so much. Okay, next we have Dr. Townsend.
I think I want to end with that one. That was that was great and motivational, but no, just in line with that, I just want to encourage everyone to continue this effort, joining these panels, doing the work yourself so that you can be a support to the next person. I think it's true that hurt people, but what happens when healed people? What do healed people do, right? So let's continue to heal so that we can heal the next generation behind us.
I love that. Thank you so much. Okay, last but not least, okay, Randy Flynn.
I just want to say, first of all, I feel that this was a great event, that it didn't go over people's heads, that we were able to just speak about it in a relaxed form. So it captivated our audience attention. I just want people to know that, it's okay to go to therapy. It's okay to not be okay. And it's okay to pay your tithes and your copay.
Thank you. And thank you everybody for joining us. Again, this concludes today's session. Okay, stress, trauma, and mental health. And so thank you again to my panelists. Bye-bye.
Bye.